In this section, a group of doctors will explain a very important disease called hyperthyroidism.
Good afternoon. Hyperthyroidism, also known as an overactive thyroid, occurs when the thyroid gland secretes too much thyroxine hormone. Hyperthyroidism can speed up the body's metabolism, causing unintended weight loss and rapid or irregular heartbeats. One of the most common causes is Graves' disease. It is estimated that 30% of the Mexican population suffers from one, without being aware of it. It can affect any age, but it is more frequent in young women, and they do another peak of frequency in the elderly. Although hyperthyroidism can be serious if it is ignored, most people respond well once it is diagnosed and treated. Dr. Octavio, what else can you tell us about the etiology of this disease?
Etiology and causes. Hyperthyroidism consists of an increased synthesis and secretion of thyroid hormone, thyroxine, T4, and thyroid T3 in the thyroid glands as a result of the presence of thyroid stimulation in the blood or of an autonomous thyroid hyperfusion. This disorder may also be due to an excessive secretion of thyroid hormone from the thyroid without increased synthesis, which is usually secondary to the destructive change seen in various types of thyroiditis. The most common causes are in general Graves' disease, solitary or multinodal toxic goiter Plummer's disease, and inflammatory thyroid disease thyroiditis. But can you regarding the classic symptoms? Dr. Jenkinson, can you tell us about it?
The clinical manifestations include weight loss, palpitation, nervousness, fatigue, dyspnea and exertion, tremor, diarrhea, excessive sweating, edema in the lower limbs, intolerance to heat and preference for cold. Even in children, rapid growth occurs by acceleration of maturation. In patients older than 60 years, cardiovascular and myopathic manifestation occur predominantly. Some young women may have amenorrhea or infertility as the main symptom. Knew that you know to recognize the symptoms? Do you know which is treatment? Dr. Sinan, can you tell us about it?
You need to go to the doctor because the treatment depends on the cause. For example, generally hyperthyroidism is treated with thiazide, like methimazole, thiamazole, and propylturacil. These drugs drive regular thyroid function, but with them are administered beta-adrenergic ones like propranolol, atenolol, and metoprolol, with the objective of decreasing party effects like nervousness and irritability. In other cases where the pharmacology treatment isn't enough, because the principal cause stays constant, it's necessary to perform surgical procedures like conservative and not conservative. About conservative, this procedure is with radioactive iodine. Other procedure is partial thyroidectomy. About not conservative, the total thyroidectomy is performed when the thyroid function is very engaged. That's all for today. See you later.